They must rethink the whole concept, because you cannot fulfill universal healthcare without the HR component. The HR component is the staff. As we are talking, the nurses are out there on strike, and they are raising issues, pertinent issues, because they got into a contract with the CBA, with the Council of Governors and the national government. A few months down the line, the CBA has not been honored. So if you have a staff which is demoralized and disillusioned, there is no way you are going to achieve universal healthcare. Because as we are talking, there are counties like Homa Bay, Kisumu, where the staff are almost out there 100%. So the issue is not just about having cards. If you have a card and you go to hospital and you can't get treatment, then the card means nothing. So that is a major challenge. That must be looked at. The clinical officers are also threatening to go out there. The HR issues in the health sector must be addressed for you to achieve universal health care. There has been a rollout in some of the counties and it's doing fairly well, but we need to address those issues because the counties are very critical in this arrangement. The national government also is very critical too. NHIF is also a major player in the whole equation. But you've seen the corruption issues are affecting NHIF. They must be addressed because if you are having money coming in and most of it is being stolen by the political class or their cronies, then you will not have the claims being settled in time. Then you will also not have the money reaching where they are supposed to be channeled. You also have issues at KEMSA because there have been serious issues in terms of procurement. KEMSA has been having challenges in terms of delivering the drugs on time. Then at the same time, the cost. And the counties have also mismanaged some of the money that they owe KEMSA. So they are not able to pay what they owe KEMSA in time. At times you get KEMSA is stocking drugs which are not in need. So they need to have a system which shows which drugs are required and which materials are required where in real time, so that you are able to know what you need where and when, rather than just having a lot of drugs which are maybe some of them are even getting expired here. So those are the issues largely affecting the health component of the Big Four. He must sustain the fight against corruption to the end, because the cost of credit has gone very high because of corruption. And money that is supposed to have been used to achieve some of the Big Four is being stolen and being lost through corruption. You've seen reports about 3 or 4 CSs having been given bribes of up to 9 billion. You know, that's a lot of money. When you look at what the nurses are asking for, it's 28 million per county on average. So in a year, they are talking about 800–900 million. And here you have 2 or 3 fellas running away with 9B. So you see, if you have that kind of money, and you know, corruption makes the cost of doing business very high. So if you have money that is supposed to have been used to render services being taken by a few people who live in opulence, then you will not be able to achieve some of those issues. So he must sustain the fight against corruption, because that is a major hindrance to the achievement of the Big Four. Then address the legal and political challenges, because they must address, apart from just talking about it out there, there is so much that needs to be done. There's so much consultations. The PDU, the Presidential Delivery Unit, must engage. And the approach that they have been using now, which is multi-sectoral, seems to be getting more results than when you had every other ministry doing their own thing out there. So I think that approach now is better than when they have centralizing all the issues under Matiang'i, bringing in issues of coordination. Then now you have a multi-sectoral approach. I think that is a better approach. But the issues I've been raising need to be addressed.